staying with this issue of no water, two major hospitals, Helen Joseph and Rahima Moosa Mother and Child Hospital, have been without a stable water supply for more than a week. I think it's actually longer than that. Between them, they have about 800 inpatients and more than 120 of them are children. The Gauteng Health Department attributes the problems to the challenges experienced by Johannesburg Water. For more on this, we are joined by human rights activist Mark Heywood. Thank you so much for your time, Mark. We do appreciate it. I think this situation is really concerning and alarming, and you've done some extensive work when it comes to the impact that the water restrictions have had on hospitals. Tell us what you know and what you have found so far.
Good evening. Well, as you said in your introduction, it's in fact been nearly 2 weeks that there has been no water or intermittent water supplies to Helen Joseph Hospital and to Rahima Moosa Mother and Child Hospital. And you can imagine that in large hospitals with no water, not having water creates all sorts of problems. It creates problems with cleanliness in the hospital. You need water to run ICU units. You need water for toilets. You need water for cooking. And by their very nature, hospitals are places where people come to when they are sick, and they need to be protected from bacteria, from germs, from dirt. And that is not happening. So I think, the consequences are difficult to spell out at this moment in time, but I know of doctors who have had gastroenteritis as a result of this. I know that the morale amongst workers is very low. I know that the morale, not just amongst healthcare workers, doctors and nurses, but amongst cleaners is very low, because a report that I got just a couple of hours ago, I won't use bad language on your program, but people are having to clean feces off the floor as we talk in Helen Joseph Hospital because toilets are overflowing, and toilets got blocked when there was no water. When the water came back, they caused flooding, and feces is flowing out into the corridor. I don't know if that is enough for you, Heidi, to give you a sense of just what a disaster this represents.
An absolute disaster. And Mark, I just want you to bear with us, because we're going to bring up a graphic just to show that the dams are indeed very full, and we do know that we've been told by Rand Water that the heat wave has exacerbated the water crisis. But as you can see here, I'm going to just read it out for you, Mark, and to our viewers so that they can see. Basically, the whole Vaal River system is at 93.8%. Earlier this week, it was just over 95%. So that is very full. And most of the dams, I think there's just three of them that are just under 80%. So that is a huge problem, that we are being told that the dams are not coping because there's a heat wave. We haven't had our spring rains. And I'm sure this is definitely being felt when it comes to the doctors and healthcare practitioners, even cleaners at these hospitals, to say, stop blaming it on the fact that we haven't had our spring rains. It's possibly got to do with the fact that you are not coping with the load shedding, but also with aging infrastructure and lack of maintenance. And we're speaking about hospitals here where they're supposed to have constant water supply, and they need to be as clean as possible. I mean, you're dealing with patients, Mark.
Yes. No, let's be clear. You say it's possibly due to problems with Joburg Water or City Power in Johannesburg. It's not possibly, it is. It is to do with poor planning, poor management, poor oversight, and collapsing infrastructure. And all of these things we have been aware of. The water shortages that are afflicting the hospitals at the moment, it's not the first time it's happened. It happened 6 months ago. It happened a year ago. People who hold positions of political authority, or people who are senior in municipalities or Joburg Water, need to make a plan for these type of things. If load shedding impacts on the ability to deliver water, as it is doing, then make a plan to deliver water. With Helen Joseph Hospital, there are water tankers that are sent to the hospital, but they are insufficient. They don't have enough pressure to pump water to the higher floors in the hospital. And the ICU, I believe, is on the 4th floor of the hospital. So these are all I believe, patently obvious things that could be addressed if there was proper planning and proper management. But the impression that you get is that politicians and public servants don't care at the end of the day. I mean, they're not there at the hospitals this evening scurrying around trying to solve the problems. They're not communicating to the doctors and nurses and specialists and cleaners, telling them when this will, how long this will last, how they will address it. They are AWOL.
I mean, the fact that you're telling me in your previous answer that doctors are actually getting sick because of this, it's so mind-boggling that the government would allow this to continue when the signs are very clear. I mean, there's blood on the floor and nothing is actually being done here. I just want to quickly speak about the fact that we've even had to bring in, or we've seen NGOs like the Gift of the Givers coming in to drill boreholes because of the water crisis. So this is not something new, and I think we must make that rather clear, is the fact that, for example, at Helen Joseph and Rahima Moosa Hospital, the water crisis has been ongoing for some time. And what's rather shocking and alarming is now we have a new mayor, and the previous mayor had said it's a previous administration. Now the current mayor says, yes, it's load shedding and the heat wave. But okay, we know that these excuses or these reasons have been given. But what is actually being done to find a tangible solution so that doctors and nurses and healthcare practitioners can work in a clean and healthy environments, and also patients not being subjected to this?
Well, you're right, and I think you're asking the wrong question if you're asking me that. That's the question you should call the mayor to answer. We also have a new MEC for health, by the way, in Gauteng as of Friday. I think the 9th MEC in 10 years. As far as I know, an MEC who has little prior experience or knowledge of healthcare systems. The last one, Mokheti, was terrible. She was disinterested in her job. The last one before that got fired. So, what does it tell you? I mean, I think the politicians should come onto your show and they should say Mark Heywood is talking nonsense when he says that we don't care and that we don't have a plan. And here is our plan, and here is how we are going to prevent this from happening again. And here is how long the doctors will have to endure this for in the course of the current week and interim measures that we're taking. The answers to all of those questions lie in the hands of the people who are the paid public servants of the people in this country, who are meant to protect the constitutional right to healthcare services that belongs to every user of the health system.
Certainly, Mark. I know perhaps these questions aren't for you, but I mean, this is just a broader discussion to speak about the crisis that's currently unfolding in our hospitals and in our clinics. I just want to ask you one last question, and I don't want to end off on a negative note, but this story is really depressing, and it's alarming that this is happening. But do you think it's going to get worse? And what are the doctors and nurses that you engage with at these hospitals telling you? Do they see any kind of change coming anytime soon?
Well, the doctors and nurses are depressed. I mean, they experience the indignity that their patients are being put through. They know the risk that their patients are being placed in because of the dirt and the lack of water. They are people who work extremely hard under ordinary circumstances, and for whom you don't need to make the provision of healthcare even more difficult. We are losing doctors and nurses from our healthcare system into the private healthcare system, out of the country. And we're losing it for precisely this type of reason, which is that we make it impossible for doctors to practice medicine and to keep their Hippocratic oaths to always look after the best interests of the patients in their care. So there's all sorts of ramifications to this. And I'm an observer. I'm just a human rights activist and a journalist writing about these things. I'm not the person in this hospital, as you and I are having this discussion, confronting these conditions, or the doctor who's at home this evening thinking that he or she is going to have to go back tomorrow morning to face this once again. So it's a very, very terrible situation.
It's actually disgraceful that this has been happening for some time. But thank you so much for your insights and for all the work that you do. It's definitely acknowledged and recognized. Thank you so much. That was human rights activist and journalist Mark Heywood. I just find it completely unacceptable that government has continued to allow this to happen. I mean, water is life, and there's no water in hospitals where it's needed the most. I fail to understand how this continues. We'll